So hello viewers, welcome to another vlog, and today in this vlog I will talk about the process of bone marrow aspiration and biopsy. So first we have to know what is a bone marrow. Bone marrow is a specialized tissue. Bone marrow is a specialized tissue. Why it is specialized tissue? Because bone marrow is the place where the cellular elements of blood, that means RBC or red blood corpuscle, WBC or white blood corpuscle, and platelets. So these cellular elements, they are formed within the bone marrow. So bone marrow, where these specialized tissues are present within our body. So these uh, this tissue usually resides within the bones of our axial skeleton. That means vertebra, skull bone, proximal part of long bones, uh, some parts of the ribs. So these are the common places in an adult human being where we can find bone marrow. And bone marrow is the place where the blood forming elements they reside. And inside marrow, all these blood forming cellular elements, also known as precursor cells or stem cells, they reside, they divide, they mature, and they form mature cellular elements like red cells, WBC, or platelets. So, this is bone marrow. Now, what are the usual places to perform a bone marrow examiner? The most common site for a bone marrow examination, that is the iliac crest. So this is the iliac bone, and this part of the bone that is known as the iliac crest. So this is one of the most common locations to perform a bone marrow examination. Also, bone marrow examination can be done from tibia, or sometimes it can be done from the sternal bone also. Now, what is the exact procedure to perform a bone marrow examination? So first, we have to take written consent from the patient or patient relatives about this procedure. We have to explain them the exact procedure, what are the risks, and how you are going to perform the procedure. You have to explain to the patient and patient relatives about the procedure, each and everything of the about the procedure. Then if they agrees and if they give you consent for this procedure, then you have to proceed. So it can be done as a outpatient department procedure. It is not necessary to admit the patient each and every time you are doing a bone marrow examination. So it can be done on an outpatient basis procedure also. So what happens in case of bone marrow aspiration and biopsy? First, you have to uh, give some local anesthesia to the part of the bone. Especially, you have to give local anesthesia by uh, lignocaine in the subcutaneous part, then in the deeper portion, and also don't forget to give local anesthesia or lignocaine to the periosteal region. So first we have to infiltrate. the local anesthesia in the periosteal region along with the skin and subcutaneous tissue. Then we first introduce the bone marrow needle. Here in this picture, you can see there is a bone marrow aspiration needle. But with this needle, you can only perform bone marrow aspiration only. To perform bone marrow aspiration and biopsy, you have to have a needle called Jamshedi needle. So with the help of that needle, you will introduce the needle through the iliac crest by piercing the outer part of the bone, that is the outer part of the bone that is known as cortex. Then after piercing the cortex, you will reach the uh, medullary portion or the spongy marrow portion. Then first, with the help of a syringe, you will aspirate the liquid portion of the marrow, that is called bone marrow aspirate. After taking out the aspirate, you will also be doing a marrow biopsy. What happens in case of biopsy? A small piece of bone along with the marrow spaces, along with a small portion of the cortex also, you have to take it out and you have to send it for histopathological examination. So the reporting part, it is comprised of two portions. The first is reporting of the bone marrow aspirate and reporting of the bone marrow biopsy. So usually the bone marrow aspirate reporting part, it takes 2 to 3 days on an average, and bone marrow biopsy reporting, it takes approximate 5 to 7 days. So to get the maximum information from a bone marrow examination procedure, you need to have both these reports. So, the bone marrow examination that comprises of bone marrow aspiration and bone marrow biopsy, the procedure takes on an average 20 to 30 minutes. Now, the indications can be any form of abnormal marrow function. That means any abnormality of the RBC, WBC, or platelet in terms of quantity or quality. Suppose there is a decrease in the number of RBC, WBC, or platelet combined together, that is known as pancytopenia. So to investigate the cause behind pancytopenia, you can perform a bone marrow. In case of some acute leukemia or blood cancers, you can perform a marrow. In case of some lymphoma that involves bone marrow, you can perform a marrow. Some other solid tumor or cancer that can involve a bone marrow, to detect or identify the marrow involvement, you can also do a marrow. And there are some other indications where you can also perform a marrow. So this is about the bone marrow aspiration and biopsy. If you have any queries regarding this topic, you can also comment it in the comment section below. And if you find this video helpful, then don't forget to give us a like. And if you are new to this channel, then don't forget to subscribe. Thanks for watching.